What is trauma? It comes in a spectrum of different forms. If we are to extract a general gestalt, we could perhaps call it some kind of event or circumstance that affronts one's sense of safety, whether physical or psychological. Physical trauma can come in the form of violent or sexual forms of attack, during which the sanctity of bodily safety and integrity is undermined, thrusting one into a state of chaos and survival. As organisms that have evolved to respond to recurrent stresses in our past, we therefore have a certain stress response mechanism that is designed to coordinate responses to such things. There are both experiential and physical components to this response. Some often report a sense of dissociation, a kind of floating out of one's body when facing a traumatic situation. They may feel like a detached observer, numbed to sensation, watching the events unfold. One can intuitively see a kind of pragmatism to such a reaction, an analogous pragmatism to the use of anesthesia during surgery. Dissociation protects the person from having to confront the traumatic experience that appears before them. And I think it can't be understated how profound the nature of dissociation is in relation to our mental lives. In order to go about our days and conduct our affairs, it is necessary to inhibit our perception with some degree of dissociation. Attention, properly understood, is a simultaneous neglect/dissociation from all the things that one is not attending to. Attention highlights and foregrounds phenomena, an operation which places it as a primary element of our conscious lives. How we use and understand attention will relate to our understanding of dissociation and its role in trauma. I am not an expert on any of these things. I'm not an academic or a doctor. I have no real conventionally established credentials. I'm merely a conscious human being who has suffered to some degree in life, and yet I've also healed a significant portion of that suffering. Healing, as far as I understand, doesn't have a set endpoint. It is an enduring process. I want these reflections in this podcast not to be a prescriptive guide on how to heal from and integrate trauma. They are merely a reflection of my own personal acquaintance and understanding. Attention and the unconscious. Your consciousness is an iceberg. What we are acquainted with when we experience the world as it appears in the here and now is a small sliver of the entirety of our mental lives. Like an iceberg that sits with a small surface exposed above the water and a deep and rich underbelly submerged below, our consciousness can be said to share a similar structure. A proper appreciation of this fact would seem to suggest that we are all mysteries, even to ourselves, that all we could ever claim to understand is but a minuscule aspect of the entire goings-ons in our mind. From one perspective, this ignorance that we have to our entire unconscious could seem as rather absurd and unsettling. Indeed, it does create a kind of known unknown that lies just beyond the veil of perception. If one is unsettled by such things, then I don't know what to say. Would reality be more interesting if you knew everything? I personally don't think so. It is the unknowns, the surprises, that provide authentic spice and challenge to life. Without them, life becomes stale, mundane, and boring. The simple observation that within your own mind lies a cesspool of surprises shouldn't shock, but should arrest you with profound curiosity. This curiosity shouldn't be a naive kind, however. Introspection is no easy task. It can be quite a psychologically intense experience to confront the naked dynamics of mind. There is no escape from yourself here. One can simply choose to look or turn away. There are many different ways in which one can turn away from themselves. Addiction and entertainment are popular methods. I say this not to pathologize such things. Often one has to go through certain distractions, trials and tribulations in order to arrive at a deeper understanding of themselves at the other side. It is often in the action of running through fire that we become truly actualized as human beings. Addiction is the trauma that I am most acquainted with. Hence, most of my discussion will pertain to this. Sexual trauma and combat trauma are very different phenomena which I cannot speak to. In addiction, one's life force becomes narrowed into a recurring pattern of short-term dopaminergic gratification. One's temporal horizon significantly shortens, their orientation to life being sharply fixated upon the gratification of the next pleasure. Your life becomes a hedonic treadmill, which slowly speeds up as tolerance builds, requiring more and more rewarding stimuli to satiate a desire that cannot be sated. You look upon life like a hungry ghost, searching for a fullness that is ultimately illusory. The absurd thing is that you can know this futility of your endeavour on an intellectual level, yet this doesn't stop your body from yearning, a kind of aching for illusion. Perhaps the process of addiction is the burning of karma, a necessary process towards attaining a deeper and heightened awareness. One needs to lose themselves in what they aren't in order to return to what they are. I've learnt a tremendous amount from seeing myself destroy myself slowly. There is no greater lesson than that, and I continue to heed such teachings even today, and likely for the rest of my life. I exhibit no shame. It was pain that led me down that path, and it was pain that brought me out of it. In this sense, pain and suffering are often the most powerful and unforgiving teachers. Our confrontation with such things is akin to being alchemized by fire. One is not sculptured softly. You are battered and bruised, viciously vulnerable, deprived and hollow. You walk around like an empty observer, apathetic and indifferent, a detached observer, not a participant in life. When one is in this addictive cycle, one is dissociated fundamentally from themselves. This dissociation, whilst protective in certain contexts, as it does in addiction, can tilt into pathological excess. This is something I learned from my own personal addiction to ketamine, a dissociative anesthetic. A lot of attention has been given to this compound for its potential therapeutic action regarding depression, amongst other things. I'm not ignorant of such applications. In fact, I very much still believe that it is a compound with significant promise, despite my own acquaintance with its significant drawbacks. We can understand its action as a compound through its classification as a dissociative anesthetic. In higher doses, it does have significant psychedelic-like effects, with the capacity to induce dream-like, out-of-body and mystical states of awareness. It is important, however, to pass it from other serotonergic psychedelics such as psilocybin and LSD, since they have notably distinct pharmacologic profiles, mechanisms of action and consequently experiential effects. For one, LSD and psilocybin are not commonly known to cause addiction, in fact quite the opposite. Research from even before Prohibition detailed their surprising efficacy with regards to treating addiction. There is some research to suggest that ketamine could also have some applications with regards to treating certain kinds of addiction, in certain controlled contexts I should add. However, ketamine addiction is also a notable risk when considering its litany of effects. Intuitively, we can understand why this would be the case, given its action as both a numbing and dissociating agent. Addiction is often a desire to escape from one's present circumstance. If their present circumstance is perceived to be stressful, unbearable, and unsatisfying, the activity of escapism comes to be seen as all the more appropriate and desirable. This is even if this is not a long-term viable solution to their problems. As organisms, we all intuitively move from conditions of discomfort towards states of comfort. This is a raw foundational drive that we cannot choose. One therefore cannot be blamed for wanting to avoid pain in favour of pleasure. We all do it to a certain extent. Addiction is simply a case where this pleasure drive becomes distorted and fixated upon shorter and shorter time horizons. This temporal squeezing evaporates one's capacity to think for the future. Their entire world becomes an empty and lacking now. One knows himself to be deeply lost, and in reaction to this psychological homelessness, a false refuge is found through external means. One's entire world becomes fleeting moments of fullness, and then long extended moments of lack. Our culture pathologizes the addict, choosing to ignore the initial conditions which drove the addict to seek escapism. I do not personally externalize responsibility to society for my addiction. It was in part myself which put myself into that situation, and as well it was myself which pulled myself out. What I did was an unhealthy coping mechanism. I've now found healthier ways which provide a longer lasting and more fulfilling sense of purpose. I still empathise with the addict's predicament, since I have seen it myself, and I seek for my words to inspire deeper empathy and understanding to the nature of this thing. We so readily demonise and pathologise that which we do not understand. There is no affliction that is more pathologised than addiction in our culture. We assume total responsibility to the addict, prescribing shame as our treatment procedure, blaming them, looking upon them with disgust and disdain. Conversely, we reward and celebrate addicts who channel their compulsions into socially desirable ventures, such as work, athletics, and much more. Addiction is the dark underbelly of a hyperproductive society. It is in some sense a disequilibrium of our generative drive. You see, we are inspired to create in this world, and our dopaminergic motivational machinery drives us in this direction. This drive, however, can become captured by hedonistic distraction. This is why so many creatives and musicians are renowned for substance abuse problems. It may be because drug use is glorified in such cultures, but there is also a more psychological component, particularly in relation to their predisposition towards hypersensitivity. Some of us simply perceive, sense, and feel more in our internal worlds. This is not a good or bad thing, it just is. Such a hypersensitivity can be both a blessing and a curse. It can facilitate a heightened awareness for subtlety and deep patterns that most cannot see. This awareness can also lead to a kind of alienation, for they become secluded in their own internal landscapes, which many may not be able to relate to. This sense of seclusion, and as well a deepened capacity to feel, not just intellectually but emotionally, can predispose one to seek escape and respite through pathological means. We all want comfort. We all want love. But for some, this is not a possibility that is afforded them. The afflicted are everywhere and always present, but where there is affliction and trauma, there is the opportunity and space for healing. Take that opportunity for yourself. We heal through our wounds, and there is no final destination to the process of healing, only progress.